surviving 10 years of living with cancer. And I invite all of those people in that landmark to join me in ringing the bell. You have to get up. You have two choices. You can lie down and give up, or you get up. And if you get up, we're going to fight. Welcome to Jack Ostrow's Hope Podcast. Hold on to positive energy. This is a story of an active male, being me, age 63, with no major health issues, discovering he has life-threatening kidney cancer. My partner through this journey has been my lovely wife. This is Shauna.
Welcome, everyone.
Shauna's been by my side every day for 10 years, 30 years before that. But every day at the doctor's office, every day at the hospital, as required. And not as required, but that's been her mission. And she's...
for better, for worse.
Well, you know...
I want the better.
We would all like the better. And also, I have to thank my children who have been a big part of this as well. This is not just an illness that affects me, it affects the entire family. And I'm sure there are a lot of people who understand that. So what I want to do is go through my history and hope that in going through that history that we'll be able to identify some issues that, you know, some kidney patients or their family relatives can identify that might help them. So firstly, just to put things into context, the content shared on the podcast reflects my personal journey and experience as a cancer patient. I'm not a medical professional, and nothing discussed in this podcast should be considered medical advice. Always consult with your doctor or qualified health provider for guidance related to your health, diagnosis, and treatment options. Every person's medical situation is unique, and professional advice should be tailored to your individual needs. We want to tell you about my story, which is now 10 years in the making, and to raise awareness. What are the things, you know, how I discovered kidney cancer and what you should be aware of. So first I'm going to go through and sort of tell you about the symptoms of kidney cancer. I'm going to go through the list. So you may notice some, or conversely, in my case, very little applied to me. So the typical symptoms of kidney cancer, this comes from Canadian Kidney Cancer Society. It's blood in the urine. And that would clearly be a sign that would get me running to my doctor. Did not have that. Pain in the back and side of the abdomen. Had no pain whatsoever. A lump that became felt in the abdomen. There was no lump, at least for me. Swelling of the legs and ankles, not applicable. High blood pressure, yes, applicable. Had high blood pressure since my 30s. I was always overweight, so that was clearly an issue for me. But my doctors were always aware of that. Low red blood cell count. Anemia, I did not have. Fatigue, no. As a matter of fact, I rode with a friend. We biked on the day before we discovered kidney cancer for 2 hours, and it was one of the best rides. He said I had one of the best rides I ever had. So here I was thinking I was relatively fit, but at the end of the day, you know, I was carrying cancer. Fatigue, I think, you know, is pretty common. Night sweats I never had. Loss of appetite, definitely never had. Fever, not at all. And for men, a large swollen vein in their scrotum, did not have. So I am asymptomatic.
But there were symptoms that you did have that you can discuss. And the other issue is, I think a lot of people dismiss things. I have pains. I lifted a heavy case of water at Costco, or I'm tired because I didn't sleep well. I'm worried, you know, something going on at work, or my elderly mother. So too often people dismiss symptoms, which are red flags that something's going on, out of fear, denial. They you know, it's difficult to accept that there's something seriously wrong with you, so we dismiss symptoms.
We don't want to deal with it. And certainly that was the case for me.
Your symptoms maybe.
There were symptoms that, you know, my breath 6 months prior, or maybe even a bit more than that, my breath turned sour. And I was concerned about it, but I
Like
also,
that,
I was
what
also
did you
worried
do?
about it.
He bought mints.
This is
Okay,
true.
so that masks a symptom. That's not dealing with the symptom.
Again, then I started coughing and hacking.
And burping.
Right. This is 6 months before. And what
All
did you
in
say?
film. Go to your doctor and ask to be scanned.
And I listened. I did go to my doctor, and what he's prescribed was antibiotics to deal with an infection. And that lasted, took the antibiotics for, I don't know, 7-10 days, and that did not make any change. Went back to the doctor, and this time,
And you also had frequent urination. And instead of going every hour, then it was every half hour and every 20 minutes. That is also not a normal symptom.
well, I don't think it was that often, but irrespective, again, denial. At the end of the day, he prescribed or he organized an ultrasound. And this was approximately mid-August of 2015. I go, get the ultrasound, I'm lying down, and of course they're using this tool, this wand or whatever mechanism they use that presses against her abdomen to test or to get the ultrasound results that they want. And I recall the technician going to the screen and having a look and coming back and doing it again and pressing down rather hard. And she didn't look very happy. And then about 2 minutes later, she stepped out and called in another one of her associates. And she did the same thing again with that magic wand, if you will. And she didn't look very happy either. And I certainly felt quite uncomfortable. But as you know, technicians are not allowed to discuss the issue with you. And I thought, okay, I'm going to hear all about it, but that'll be when I have my next visit with my doctor. On the morning of August 31st at 8 a.m., I got a call from my doctor, urgent. Come and see me in the office at 9 a.m. And just could hear it in his voice. Sean and I arrived at 9 a.m. and he gave us the news. I had a cancerous growth on my kidney.
Not on.
In my kidney. My kidney was cancerous. It had grown to 33 centimeters.
How big is that?
Well, it's about the size of a small football. To put that in sort of other terms, it's approximately a 12-inch tumor, but round. And that is a big tumor. And again, to provide some context that I only learned in subsequent years when I was not on medication, my cancer would grow at the rate of approximately, let's say, 2 centimeters a year. Let's say 3 centimeters a year. That's 10 years of growth. I mean, I have no idea.
And it's flora.
I had no idea if that was a straight line. Growth. Irrespective, it was a very large growth. Further, as Shauna was indicating, it was so big that it needed another blood source, and it attached itself to my thorax. So we had a very complicated kidney cancer to deal with. My family doctor recommended that I see a surgeon at North York General and have the surgery right away. And we went home to think about it. Personally, we were quite shocked, and then we had to get very rational. What made the most sense? And I had a lot of respect for North York General and the surgeon he had recommended, but we recognized this was a cancer issue, and we also knew that the best cancer hospital in Toronto and amongst the best in the world is Princess Margaret Hospital. And due to the complexity, we thought it'd be best to go contact them. The other thing that we didn't know is how much time do we have? And a 33 centimeter, tumor is rather daunting.
Overnight, you're going, am I going to be a widow? My children thinking, am I going to lose my father? And if not, if he has surgery, how long will he be off work? Will he be able to go back to work? If he's not working, how do we pay the bills? There's a lot of anxiety, fear, and issues that are raised overnight with a cancer diagnosis.
So you're under pressure to make a decision. But I called my brother-in-law, who's an ear, nose, and throat surgeon, specializing in cancer in New York. And he said that, given my cancer and how long I had it, that, waiting a little while, a couple of months would not change the outcome. And so I called down the PMH. We found a surgeon that was highly recommended. And I requested the meeting with the surgeon. I was asked if that was a surgery that he could perform. I was speaking to his associate. And the answer was yes. But unfortunately, he was doing seminars somewhere in Europe and wasn't coming back till late September. So that was the earliest date I could meet him. We met. He said he could do the surgery. And
which he indicated would be incredibly painful to recover from and requiring a 5-day hospital stay.
Well, I was being rather optimistic and asking if this could be done laparoscopically. And he sort of laughed. He says, Mr. Ostroff, you will have a 10-inch incision. And I have to tell you now that this is one of the most painful surgeries that we perform. But I will do the surgery and to recover from. But we booked a date on October 31st was the surgical date. And my job was very simple. It was to show up. They injected what is it called?
They inserted in your hand.
Yeah, inserted a needle in my hand. I guess that feeds the various medications. And then I went to the operating room. I sat down on the table. The surgeon said good morning to me, asked me how I was feeling. I said, I'm feeling good. I said, more importantly, how are you feeling? And he said, great. And then he asked me to count down from 100. I don't think I got to 95. And I was out. That's your job. At least that was my job, to show up. He was brilliant. His associate came in and spoke to me after the surgery and said that the doctor was absolutely brilliant in a very difficult surgery. The surgeon came in and spoke to me after, and he said he was hopeful that he got it all. He said it was complex, but he was optimistic. And I guess that in the context of all of that, it was probably the best we could hope for. Recovery, got to go home in about a week, thereabouts, about 6 months to recover. Painful, yes, but guess what? The meds are pretty good. And, that was, it was quite an experience. However, you do what you have to do. So in the course of these podcasts, what I'm trying to do, would like to do, is to convey to you some of the lessons I learned. And hopefully this will help you. So the first lesson, the comment that comes from Bill Gates. He says, life isn't fair, get over it. And he's absolutely right. Life isn't fair. And I think we all can understand that. Get over it, not so easy. I mean, he is right. You do have to get over it. But there are times I have difficulty getting over it. But it doesn't help you. There is no time to feel sorry for yourself. That doesn't help you either. You have to get up. You have two choices. You can lie down and give up, or you get up. And if you get up, we're going to fight. But you need your family there. You need Shauna. You need
your children, your family, your friends.
Everybody.
It's a community that gets you through that.
And here's the other thing. You're going to get knocked down during the course of this journey many times. Here's the other lesson. Don't lie down, get up again. Get yourself moving, get into physical shape the best that you can. And that will help you in your journey. You'll feel better. Also, don't get ahead of yourself, much like I did at the very beginning. Well,
that's human nature. You automatically assume the worst.
So when we discovered I had cancer, right, and I'm waiting 3 weeks to be seen by the doctor, I would do laps between the kitchen, the dining room, the living room, back to the kitchen.
I should have given you a Swiffer when you were doing all that.
Well, that's probably true. There are a lot of laps. There's a lot of stress, but the reality is that's just part of it. When I say don't get ahead of yourself, we all tend to go to the worst possible outcome. And my experience has been that while you may think about the worst possible outcome, there's many things that can help you along the way. And it's rarely as bad as you may think. So don't go ahead of yourself. Live in the moment. Enjoy every day. And also, the other reason we're doing this podcast is we're hoping to raise money for Kidney Cancer Canada and Princess Margaret Hospital Foundation. We encourage you to look at the next 2 pages of the podcast where you'll get instructions that can take you directly to Kidney Cancer Canada to make a donation, or PMH, as you wish. And don't feel any pressure, but if you can, just remember that everybody gets affected by this. And hopefully not you, but unfortunately, there are many. And typically they've affected most people, most families. Everybody knows somebody. And so we're asking you to help in research, which will help many during the course of their journey. So, do the best you can. And we thank you very much for listening. And we will
wishing you NEDS, which stands for no evidence of disease.
And that's really important. That's the best you can get to. So just to put that into context, when I had the surgery, the surgeon was able to remove a 33 centimeter tumor. What he's able to do is look at the physical manifestations of the tumor and remove that and know that he's done that successfully. What he can't do, and science isn't able to do, is tell you what cancer exists in microscopic form and may be traveling through your body. And so the best we can hope is for no evidence of disease, meaning that it doesn't show up on scans. Doesn't mean that it doesn't exist in your body. And I think the rule of thumb is 5 years without evidence of disease before they believe you're cancer-free. I will likely never be cancer-free. However,
your tumor had extended, it had metastasized and extended into the vena cava vein.
Right.
So it was not just contained within the kidney.
Right. But at that point, we didn't know anything other than the fact about the kidney itself. And we had to wait. And our next step was to do a follow-up, which was a CT scan 6 months later, which we'll discuss in our second segment. Thank you for tuning in.
Stay well.
Keep well. And
Exercise.
take care of yourself. And tune in for our next podcast.
Thank you.
Thank you all.